Welcome to the Champions of Active Women podcast. In this podcast, we will interview individuals who have been successful within athletics and beyond. We hope that these interviews will encourage and inspire girls and women to be active for a lifetime, to reach their goals, and to break new barriers in sport and life. This podcast is brought to you by the Active Women's Health Initiative and the Sports Medicine Research Institute at the University of Kentucky. The mission of the Active Women's Health Initiative is to optimize health and promote physical activity and wellness for girls and women across the lifespan. We hope you enjoy our conversations and join us in understanding women's health today to ensure women's health tomorrow. Dr. Kim Kaiser is an associate professor of orthopedic surgery and sports medicine and family and community medicine in the University of Kentucky College of Medicine. She is also a UK healthcare team physician for the University of Kentucky Athletics and the head team physician for Eastern Kentucky University Athletics. She received her medical degree from the University of Missouri, Columbia School of Medicine. Dr. Kaiser completed a fellowship in sports medicine at the University of Kentucky and is certified by the American Board of Family Medicine. In 2019, Dr. Kaiser continued her education as part of the Mount Everest Base Camp Wilderness and Expedition Medicine Conference, where she successfully hiked to Mount Everest Base Camp. Today, it is my pleasure to speak with Dr. Kaiser about her own active lifestyle and her clinical work caring for the athletes in all of us. Welcome, Dr. Kaiser. Thank you for joining me today.
Thank you so much for having me. It's been a pleasure.
So we'll start with a really broad question. What does health mean to you?
I think health in general, it's a state of lots of things, but physical, mental, social, spiritual, financial well-being. I think it leads, all of those things in cumulative leads to a full life that has some meaning and purpose. And then when you are of good health, that allows you to adapt to new illnesses and diseases without difficulty.
So a pretty holistic, big picture of what health looks like for you, it sounds like.
It does. I feel like in the medicine aspect of things, we're curing a lot of the physical health, but so much other things play a role in it as far as the social circumstances, the spiritual aspects, the mental aspects play. And if you don't treat all of those things, you're not going to be able to treat the physical as well.
So as a medical doctor, like you said, you're focused on most of the time promoting that physical health or treating the physical health among your patients. Could you talk about what led you to this career?
Yes. When I was pretty young, I kind of wanted to do that all along, but even like grade school, I really learned about learning about the muscles in the body and how they work together to sustain us, really, and be able to do things like run and jump and play sports. And being active and playing sports was always a very big part of my life growing up with it. And so it was just kind of fascinating to me, like how fast twitch muscle fibers worked compared to slow twitch. And it sounds specific for a teenager in elementary school, but I really enjoyed that part and figuring out how it worked to also make me better to do the things I wanted to do. I also enjoyed doing logic problems in grade school. And so lawyer was kind of in the realm also of path, but figuring out those set of clues and coming to a single solution was really rewarding and challenging for me. And so kind of in high school, I started shadowing other healthcare providers and really figured out that those two loves kind of melded together to become a physician. So that allowed me to use the logic problems to deduce symptoms that cause a specific disease, and then in turn intervene to help people choose the ways that they can help and promote their own health and get away from the disease that they were experiencing.
And so it sounds like your own kind of physical activity experiences were intertwined with your desire to go towards a medical career, and we'll talk about those a little later. But I read something that I thought was really interesting in your UK healthcare profile. You said, quote, "I think everyone has an athlete within them, and we just need to bring that out," end quote. So could you talk a little bit about that philosophy and how it impacts the care you provide and just how you treat patients?
So I think bodies in general like to move and be active. And so it's a lot of the other circumstances with nature and nurture that lead us against those things. And so sometimes it's just that someone has been told that they can't do this. And so trying to figure out ways and to help the body to move, to bring out that athlete kind of within them and find that competitive drive to become better, are really the inspiration part that you just need to help with. And so a lot of times patients come in and they just want to talk, to be perfectly honest, and that's okay. And so trying to figure out what's keeping them from becoming their best self is kind of one of my personal goals, I think, with patients, so that I can help them bring out their competitive side and achieve the things that they want to do, whether it's performing arts as far as an athlete from that perspective, whether it's keeping up with their grandkids because now their knee has been hurting and they've been active all along from the rest of their life, or if it is from a more competitive weekend warrior, collegiate, high school collegiate athlete that's helping them to get directly back onto the playing field. Finding out what motivates people and inspiring them to become their best self is kind of how do I try to bring out their inner athlete and try to discover that with them among conversations, usually over the course of their time with me.
I love that idea that being an athlete and moving your body, kind of broadening the definition of athlete so that everyone is included in there, and that fundamental need to move, right? That we all need it and we all need to be athletes in some capacity. Do you ever get resistance from people who are like, really resistant to the idea of being labeled as an athlete?
Um, Being labeled, not specifically, I guess, but resistant to moving in general, absolutely. And
Yeah.
so I think that's one of the most challenging things in my job is when they have the potential to improve their own health and they just don't want to do it.
Hmm.
So again, trying to figure out things that motivate them. And usually kids and grandkids are a big thing. In the middle-aged and elderly population that they kind of dwell on their disease process and instead say, this is just a product of good life, for example, with the arthritis, and helping to get them to be back to where they were so they can get down on the floor and play with their kids again. Obesity obviously is such a big issue, not only in Kentucky, but in the whole United States and really the world. And so trying to get people to move just a little bit, whether it's 10 minutes, 3 times a day, or park in the backside of the parking lot to walk in. And then sometimes pain inhibits them, but trying to help them realize the more times that they are moving and are healthy, like joints want to move. And so helpful to try to help them to see that, and like little bits of weight loss go a long way. And so your cardiologist might say you need to lose half your body weight, which is 150 pounds, but really 3 to 5 pounds makes a big difference on your knees because you carry 5 times your body weight on your knees. So those little bits and trying to find those motivators, the most challenging parts of things and trying to figure out what it is, but also the most rewarding from that standpoint as well.
So, we all have our inner athletes, and you brought out your own when you traveled to the conference where you hiked to Mount Everest Base Camp. So, I'm wondering if you could talk about what it was like for you to train for that physically and maybe mentally as well.
Sure. The In general, it was just the best thing I've ever done to get there with it. It was also probably the hardest thing I've ever done physically with it too. And so I think in general, the Himalayas are just majestic and towering. And I was actually at Disney World the year before, which kind of inspired the trip. I'm like, this is just something I wanted to do and kind of focused on that for the year. Otherwise, prior to the year before, I had no desire, not even really knew where the Himalayas were, for example. Um, but training for it was try to get as much in as I could, um, based on the fact that obviously with work and athletics, it's pretty busy. But I also knew that the altitude was going to be the biggest factor with it. And so kind of my mindset was always attitude over altitude. And so in Kentucky, it was challenging because we live and play at minimal altitude, kind of 2 to 3,000 feet. And we were flying in to start the trek at over 7,000 feet above sea
Oh my
level and
gosh.
18,500. So when you kind of look at it that way, I didn't have a chance to go to Colorado to train, or kind of the Rockies, which are still at like 12 to 14. So I just felt like I had to get in the best physical shape that I could get in. And so did a lot of cross training and spinning and strength training in the mornings every morning, usually 6 to 7 days a week before work. And then as it got closer to March and April before I left at the end of April, and trained afterwards too. And so did treadmill work at 15% incline with a pack on and with boots on, and tried to hike that for an hour. And so I definitely could have probably been, oh, you can always be in better shape. So that was definitely, but think overall was good from that standpoint. I felt confident in my physical abilities. And then once we got there, it was just I'm going to make it. I'm going to make it. It doesn't matter if I have a little altitude headache, like I'm going to make this and I really want this. So I think your mind can go a long way depending on what you want to do. And so as long as you just have that mindset that and determination that you're going to conquer it, you can really do about anything that you would like and set your mind to.
So you mentioned the spark to make the decision to want to even, kind of put that on your list of things you wanted to do. What was the catalyst for kind of what planted that seed to want to go do this big adventure?
I think several things. One is like just the physical challenge of it sounded interesting and engaging. And two, I've always enjoyed hiking and kind of long distance trekking. Obviously, this was the biggest one that I had encountered thus far, but having the opportunity to learn with a variety of different physicians was also reassuring because I was going on my own completely to Nepal, and I had honestly only been to Europe with my mom with it,
Yeah.
and really traveled, especially that far by myself with it. So having the opportunity if something would go poorly to be surrounded by other physicians and nurse practitioners and PAs who were also training and leading for that part too was kind of reassuring from that standpoint. So I think that was really the biggest catalyst, but also it was just a time in life where it was like some things are exactly where I was hoping they'd be. Some things had exceeded my expectations as far as professionally, and this was just a personal accomplishment that I really wanted for myself. And it was actually over my birthday, so that was the other motivating part that just wanted to do it for that. So it turned out, yeah, better than I could have ever imagined, to be perfectly honest. And again, was really the best thing I've ever done with it. So hopefully more experiences like that in the future as well.
Well, and that leads right into my next question. I've talked to people who are into these kind of adventure trips and hiking and climbing. And, I kind of assumed that once you accomplish one, you'd feel good and kind of checked it off. But some of these people educated me that it actually just leads into the next adventure that you want to do. So do you have a next adventure? And if so, could you tell us about it?
Yes. So I've got lots of physical goals, and it's just a matter of kind of having a long bucket list. And it may take me another 40 years to accomplish them, I think. But in the near future, I'm doing some long distance trekking through New Zealand and Norway once the world reopens as high. I'd like to also summit Denali in Alaska with it to get one of the US adventures going. Little less aggressive, but is to travel and explore all of the U.S. national parks with it.
Yeah.
And I was planning on doing Kilimanjaro in Tanzania this past summer, and then with COVID shut down. So hopefully in this coming summer, if everything opens back up again or in the near future, that's also kind of high priority on my list with it.
Yeah, I love those. Get to see the world and a physical challenge. And I assume that all of those will require some extra training leading up to them as well.
Exactly. Yes.
Wonderful. So, as you know, one of our goals within the Active Women's Health Initiative is really to promote and encourage and support women as they try to pursue active lifestyles. So, why do you think that it's important for everyone, but especially women, to engage in those active lifestyles?
Women just have a different subset of risk factors and that men don't have, for example. So cardiac disease presents differently. There's different stresses from male to female with it. Not that everybody doesn't have stress, but everybody just deals with it a little bit differently. So I think it's a very important thing to kind of keep with going, but also to encourage children and other family members also to lead active lifestyles from the get-go with it. Um, so I think they're also women are pulled in so many different ways, both socially and professionally. But many times it's the pressure we put on ourselves and the expectations that we have for ourselves. And so there's lots of different roles that people have, and everyone has the same amount of time. It just kind of depends on how you prioritize it. So getting into those things is the important part. And I think exercise and being active helps us manage those things, or at least it does for me as well, but manage those things more efficiently and productively so that I can be the best person in all those roles that I can be with it.
So you kind of started to allude at some of the barriers that women face, but either from your personal life or from your what you hear from patients, what do you see as some of the biggest challenges or barriers to women engaging in a physically active lifestyle?
I think time, and it's a subjective matter, is kind of the biggest thing with it, both with myself and with patients and coworkers and friends, all of the above. But it is a subjective matter. And so we all have the same 24 hours in a day, and it's really just how we choose to use them with it. So, what I've started doing, and some months I'm better about it than others, but is really schedule in my own time. And so, like, I'm not going to miss meeting with my boss kind of over that time frame. And so in the same matter, I'm not going to miss this workout time for me. And so some days it is an hour and a half, and that would be my ideal amount of time, I've learned. And my ideal time to exercise would be like 10 a.m. But that doesn't really work so well with work responsibilities with it. So figuring out, a lot of times it is at 5:30 in the morning, but getting it in some way, it just makes me feel better. And I think once you get into that habit, which usually establishes after a week, you'll notice the benefits of it too, of just having that scheduled time that's all for you with it. The other thing I think that pulls a lot is that as women, we give a lot to other people. And I think that's partly in our nature that we're sometimes more caring, but it is a stereotype, but it's also, I think, a little bit more true that sometimes we have a little more empathy and feel like we need to fulfill all these roles of being mom, wife, professional, teacher, and especially in the COVID area too, all of your kids with it as well. Take care of an aging parent with those things. And those things all take a lot from us emotionally and mentally. And so you have to give something to yourself back so that you can better able to care for other people as well. And so finding that exercise outlet, or performing arts outlet for that matter too. So whatever outlet it is, it's still just being active to give back to yourself so you can better care for the other people in your life.
I love that idea of giving back to yourself. So many women do give out of ourselves, but to give back. I love that phrasing there. So you mentioned scheduling physical activity into your schedule. Do you have other strategies that you suggest for patients or that you use yourself?
I think finding your passion and doing that. And sometimes passions change throughout your years and months and throughout your lifespan and based on what other people are in your life at that time. But whatever it is, like, do that for you. And so figuring out what works for you, whether it's breaking up your time slot or like going and getting the whole hour in all at once with it. Find a way to incorporate it into your lifestyle and kind of make that work. And so frequently patients ask what kind of diet works best for them. And the answer is there's not one. Keto is not very good for you, and gluten free is also not very good for you unless you have celiac disease. But really trying to get like an 80-20 rule is kind of a more of a rule that I'm trying to live by. But it tends to work well for me in that like 80% of my week, I'm trying to be healthy, make healthy food choices, take some time for myself. And then the other 20% give myself some grace. And that's how you're going to stick with it longitudinally as well and make those overall general lifestyle changes. So my biggest weakness is ice cream. And so that's what I treat myself. And it's okay because the rest of the week I've done really well with it. And so as long as you're not making that poor choice every single day of the week, you're going to make progress and you're going to be able to stick with it or stick with your weight loss or just stick with being able to train better because you are training for an ultra marathon or kind of all of those things. So incorporating that, making it into a lifestyle, and then finding people to support you is the other part. So if people are continuously negative around you, you're going to have a negative personality. So sometimes it's just time to let people go and outgrow those people or things, jobs for that matter too, that are in your life that are having that negative role. And it's not to exclude them completely, but take a step back and say, I really don't feel good about myself after I'm around X, Y, or Z kind of thing. So figuring out ways to maybe spend less time with them and be around more supportive people, or just looking at what goals you have to help people support you better to achieve those goals is kind of the other thing that I try to recommend patients, but also employ for myself.
Mhm. So it sounds like you're really leading by example in a lot of the things you're sharing with your patients. can you talk about how your active lifestyle got started and whether that involves sports or just being active and just kind of give us the backstory here?
Yeah, my parents, I think, were a big influence of that. So I was raised on a farm in a very small town. So my brother and I were always outside playing and swinging and jumping on the trampoline and riding bikes kind of that way with it. We didn't spend a whole lot of time in front of the TV, although he liked to play video games a lot, which was great for hand-eye coordination, I think, in his future
Hmm.
career. But they did a great job of introducing new activities. And so always trying something out was a good thing. And so we only had one rule is that if you started a season, you had to finish the season. You couldn't quit in the middle, even if you really didn't like it. So
Hmm.
kind of thinking it out that way. And that went from playing sports in middle school and high school to playing the piano, which I didn't enjoy much, but that transitioned into playing the drums, to creating things from an art perspective. Um, and I really never found a sport I didn't like, and rarely an activity I didn't like. So it was good, and they encouraged us to be well rounded, which I think has played a great role into being able to relate to patients in the future, kind of now with my current career, and just relate to people in general and find that common ground. Because everyone is human, and so it really is out there to find something in common with people and help them appreciate a different perspective with it. I think my grandparents also helped with that. They tried to teach us that we had to have a lifetime sport. And when I was younger, they went into recommended golf. And so I felt that that was more a beautiful walk spoiled by a little white ball. That I didn't enjoy it so much. But I think as I get older, I'm very excited about relearning that sport and being able to play that kind of from a lifelong perspective as well. Um, so I think I can definitely say my parents had the biggest influence over that.
Yeah, and I love that the support you got from your family and also just that idea of a lifelong sport. So many times we see with athletes that transition from kind of structured sport is sometimes difficult into lifelong activities. And it sounds like, although you played sports, that you were able to transition because you had so many different experiences as a young person.
It is. And sport specialization is such a huge issue now with kids and even adults too. So, in the adult perspective, we see a lot of runners, and that's just all they do. And they come in
Mhm.
then eventually with knee pain typically with it, but it's because they haven't strengthened their glutes or their hip muscles. And so your body does really need to break and be able to adapt to different modalities because just one thing is going to break it down kind of at a faster rate. So having that overall multimodal technology as far as things to do really makes a big difference, and also your performance when you are going to train for something else later on too.
Yeah. So, what motivates you to keep up your active lifestyle? One of the biggest challenges is just kind of sticking with things over the course of your life. What are some of your motivators to be active?
I'm really, I think it's how it makes me feel. And so I, it makes work more tolerable. I'm much less stressed in general and more efficient with the time I'm at work. I sleep better at night, kind of that direction as well. I'm just an overall happier person with activity. And so, especially during the winter season when we don't see the sun a whole lot, still doing that releases those endorphins that help make you feel better. um, when I take better care of myself, I take better care of others as well. And so I've noticed that as a direct correlation. I don't get as stressed and snippy with people with it. So I think that's a great motivator. The other thing is kind of the leading by example, like you had mentioned earlier and
Mhm.
touched on, is that I feel like if I'm going to give this information, like I should also be incorporating that into myself and being previously competitively athletic and hopefully still sort of am as an adult, but being around like the collegiate athletes at UK and EKU and want to implore them to also continue that lifestyle after college, but be a model for them and be as active and as athletic as they are as well, or attempt kind of that part of things. So that keeps me motivated with it too.
So, what advice do you have for girls and women about playing sports or leading an active lifestyle?
I think the biggest piece of advice is really to try everything at least once, because you never know what you're going to naturally be good at or what you're going to enjoy. And a lot of times those likes evolve and change over time with it. And so if you don't like it, then I also recommend trying it at least once more, because sometimes it's just that group of people that you were with that you didn't mesh well with, or the weather was off and it was cold and rainy, and you just had bad external circumstances to that sport or activity. So I think that's the biggest thing, is don't be afraid to try a variety of things, because you never know what's going to come out and grab you and you just fall in love with it.
Mm-hmm. And it goes back to kind of how your parents got you into activity and, getting you to try lots of things and at least finish out one season, right? Go back a couple times before you kind of X things off your list. So I love that advice. It seems to be connected to your past there.
It is, yes.
What else would you like to share with our audience today?
I think the other biggest piece of advice that I have and kind of have learned over the time, but you're really the director of your own life story. So if you're unhappy in a certain aspect of your life, you are the only one that can make that choice to help you find joy and to recreate a new future with it. So at any given moment, you have the power to decide how your story is going to end. You're also the keeper of your own schedule. And so schedule time for the exercise just as you would a meeting. Schedule time for you, whether that's a really long hot shower or a really good breakfast in the morning and a little bit of coffee and a little bit of reflection. The other thing would be to set boundaries. And I have a very difficult time with that personally. And so that's been kind of an ongoing resolution, but say no to things that aren't going to help you become that better person and better you. But say yes to lots of spontaneous adventures. Travel brings on new perspective that direction. Say yes to opportunities for new friends, new perspectives, and just surround yourself with people who are going to make you better and inspire you to be the best self that you can. And I think the last thing is give yourself permission to live a big life. So step into who you are and what you're meant to be, and find that passion and fuel that fire so that you can hold yourself up to that standard that you set for yourself.
Thank you. There's so many good messages in there. And as part of this podcast, we're really trying to encourage and inspire women to be active. And I know that some of your words will help them to do that. So thank you for joining us today.
Thank you so much for having me again.
Thank you for listening to the Champions of Active Women podcast. This podcast is brought to you by the Active Women's Health Initiative and was produced by the Faculty Media Depot at the University of Kentucky. If you enjoyed this episode, you can listen and subscribe to all of our episodes wherever you find your podcasts. For up-to-date information about the Active Women's Health Initiative, you can find us on social media at UKAWHI. Thank you for supporting us as we work to promote health and physical activity among girls and women across the lifespan.